Paris, COVID cases and deaths at U.S. nursing homes are once again on the rise. According to CDC data, Illinois saw its highest ever case rate for nursing home residents this month, surpassing even last winter's surge. Cases among staff have also reached record levels. And while resident deaths are on the rise as well, the numbers are still far short of previous records, even though some caution that deaths are a lagging indicator. Joining us now with more are Tamara Konecka, professor of public health sciences at the University of Chicago, and Joseph Quason, director of nursing at Alden Park Strathmore in Rockford. Thanks to you both for joining us. Tamara Konecka, let's start with you, please. CDC data for the most recent week available shows more than 2,200 COVID cases in Illinois nursing homes, breaking a record set in December 2020. Now, that same week saw 60 resident deaths, much lower than the record of 393 from December 2020. And although, as we just mentioned, deaths are viewed as a lagging indicator. Tamara, what steps can nursing homes take to mitigate the impact of COVID on its residents?
First and foremost, our main tool remains vaccination. So if we remember back a year ago, we were in the midst of the start of a vaccination campaign that prioritized nursing home residents and staff. And that was very successful and caused a dramatic decline in cases and deaths among nursing home residents. But that's not a one-time event, it's really a process. And we have to work a little bit harder to make sure that those vaccination rates among both residents and staff, including now boosters, stay high. And in fact, they've dropped to about 87% among residents and 82% in Illinois among staff. So our first weapon is to just increase those vaccination rates.
Joseph Quason, what has been the impact on your residents and staff?
Mostly staffing has been a major problem for us now. With the increase in cases of COVID, a lot of the staff members have to be off work, and that is putting a constraint on the rest of the staff left behind to pick up the slack.
What does that mean for your residents when you are facing staff shortages like that?
So my building is fully staffed. We have managers, clinical managers who are picking up to extra hours to help with the staffing needs that we have. Also, Alden has gone above and beyond to bring in agency staff to help with this shortage that we have now.
Have you noticed any impact on your residents and their rates of COVID?
So currently we have a 87% rate for vaccination for our residents. Like Tamara said, vaccination being the key for us too. We promoted vaccination throughout the building. We continue to push vaccination. Alden goes further to promote raffles and other programs to help with vaccination in the building. For now, with the managers picking up, clinical managers picking up, and other clinical staff on the floor helping with the staffing need, we're stable right now, but we still have challenges ahead because of the increase in the cases that we have now.
Of course. Tamara Konecka, there have been, nationwide problems of late with getting access to COVID tests and, of course, test results. How does that affect nursing homes?
It's a critical issue for nursing homes. It has been throughout the pandemic. It's important for everybody in the population to be able to access tests and get results in time. But in a congregate setting like nursing homes, it's even more important because, as you can imagine, if we can't know who has COVID, it's really hard to prevent the transmission. So accurate and fast tests are critical.
And Tamara, under a federal mandate upheld by the Supreme Court, healthcare workers like nursing home staff have until the end of next month to get vaccinated or to get an exemption. How might that affect families in Illinois?
Yeah, I think this is a really important step forward. We have had a state mandate since fall for nursing home staff to be vaccinated. But there are exceptions for that, and staff can also choose to test instead. I think the fight against COVID is going to be that much stronger and that much more potent if we can get more staff vaccinated. So I think that'll be a really important step. The one caveat is that while the state rule right now applies to both assisted living and nursing facilities, the federal mandate will not apply to assisted living facilities unless they take Medicaid and Medicare, which most of them don't. And so will have to be extra cautious about what happens in assisted living facilities so that those residents and families don't incur higher risk.
And Joseph Quayson, do you have any concern that that what Professor Koneska just mentioned, the difference between nursing homes and the allowances for assisted living facilities, that might cause a loss of staff for you?
Yes, I do. With the current cases with the vaccination rate that we have, we've promoted a lot of education and materials for our staff to follow the vaccine mandate. A lot of us, Alden continues to go above and beyond to provide us with the needs that we have. But at this current rate, we are paying 3 times the base rate to get staff to come in and help take care of these residents. With the continuous shortage, there's a competition not only with the assisted living, but the hospitals right now, because the hospitals also need staff and they are paying above the base rate to get these staff members to the hospitals. So in all, we're going to have a staff shortage. In all, we do promote vaccine and we encourage every single staff member to get vaccinated. Currently, I have approximately 15% of my staff who are reluctant to take the vaccine based on personal and religious reasons.
So it sounds like you're already competing to maintain your staffing levels. Do you think the state should change its mandate to eliminate the testing?
Currently, I think the vaccination is that's the best weapon we have against this COVID. What I know based on the knowledge and the CDC guidelines and all the research out there, the more we are not vaccinated, the more these viruses mutate. And today we have Delta, tomorrow we have Omicron. We don't know what we have in the future because of mutation. I personally believe vaccine mandate is very good. We need to put out more education to the public, the general public, about vaccines and how it works and its efficacy. A lot of misinformation out there too, but I think if we have more good peer-reviewed articles and good information out there for the public, it will help with the vaccine mandate.
Okay, that's where we'll have to leave it. Best of luck to you, Joseph Quayson. Thanks to you, as well as Professor Tamara Koneska, for joining us.
Thank you.